Hi there, my name's Anthony.
And I'm Mackenzie. We are second year graduate students in Bellarmine's Masters of Athletic Training program.
And we're here to touch on the roles and responsibilities of athletic trainers and physical therapists, what settings you can expect to see both these healthcare professionals at, the curriculums upon which both these programs follow, as well as how they collaborate together for better patient outcomes.
In the athletic training realm, the target population is typically the athlete, but can range to the general population from military to industrial to anyone who is physically active. Our responsibilities include us specializing in emergent and acute care, rehabilitation, admin work, and we also take a liking to interprofessional communication amongst other healthcare professionals. We currently work with athletes before, during, and after an injury, which is where we largely differ from other healthcare professionals. We see them throughout their entire time with us.
Unlike the athletic trainer, the physical therapist engages in a much wider and broader spectrum of populations, and this can range anywhere from not only athletes, but pediatrics to geriatrics to the physically inactive to the heavily obese, those that are riddled with chronic disease and seek treatment for their ailments. According to the American Physical Therapy Association, physical therapists are movement specialized who optimize movement to improve the human condition. This would include preventative rehabilitation, clinical diagnosis, therapeutic intervention, rehabilitation, pre and post-op for injury and illness. You will find your athletic trainer with pretty much any sports team, but you will commonly see and hear of us in a collegiate setting, a high school setting, as well as a professional setting. Aside from working with sports teams, you can also find us in industrial settings and military settings, so examples of which might be, for example, here in Louisville, Kentucky, working in the Ford plant, or perhaps just in the state of Kentucky itself, working over at Fort Knox with the Wounded Warrior Project. You can also find us in physicians' offices, hospitals, and we also take roles in administration.
A physical therapist can typically be found in outpatient clinics, hospitals, nursing homes, and in home health. Their secondary settings can be schools or with a sports team. When it comes to comparing the two programs' curriculums, there are some similarities in athletic training and physical therapy. We both undergo assessment courses. We both take pharmacology and a gen med, as well as a rehabilitation course. We undergo 2 years of clinicals, but they have a different time frame. Athletic trainings is paired along with their coursework and is started in their first fall semester. Physical therapy starts theirs in the summer of their second year, and they have more of a 40-hour intensive throughout theirs. Athletic training can be placed in a high school, collegiate, hospital, or a clinical setting. A physical therapist can be put in acute care, out of state, rural, or urban.
In an effort to increase our quality of care, the NATA will be changing the requirements for entry level for athletic training from bachelor's to the master's level starting in 2020, and this will be huge for us. Physical therapy, on the other hand, actually has the requirement of a doctorate for entry level. Some other differences amongst the two programs and curriculums is, aside from the core similarities, the differences would be that physical therapy students actually have classes for their more specialized populations. So this would include pediatrics, geriatrics that I've spoken of before, as well as cardiac pulmonary and chronic disease.
We need to come together and be able to work interprofessionally to ensure the best patient care.
One of the biggest crossovers in our efforts for this better patient outcome is rehabilitative efforts. And it's important to realize that both athletic trainers and physical therapists not only play a large role in the physical outcome of this treatment, but as well as the psychological recovery for our patients as well. When we see our patients and our athletes, they are at their most vulnerable, they have gone through trauma, and it's important for us to realize that not only do we need to be able to work cohesively together, but we must be able to maintain a positive work environment as well, upon which we can foster this recovery. Common areas upon which we struggle, so adherence rates for rehabilitation is one of the bigger topics and struggles that we deal with in both professions. It's important that we should come together and we should talk about ways to motivate our patients and our athletes, ways to get them back into our clinic so they can continue our treatment so they can recover at the end of the day. One of the ways that we come together, and actually this happened a couple weeks back here in Louisville, was Bellarmine Nursing, Bellarmine DPT, and Bellarmine MSAT. We all came together to provide physicals from multiple schools in the JCPS school system.
It's so important to understand we all tie into the big picture.
Learning to coexist and advocate for each other is vital to ensure the best service that we're able to provide.
Choose ATPT.